that tiny pill you trust to protect your heart may be quietly stealing your balance, your strength, and even your clarity. What if the symptoms you blame on aging are actually warning signs that your own medication is turning against you? Welcome to Wellness Unfolds, where we uncover the vital health truths that matter most to you and your loved ones. For millions of seniors, a tiny pill is the daily shield against high blood pressure, protecting their heart and vessels. These medications are essential lifesavers, yet they often interact with the aging body in ways that remain dangerously misunderstood. Today, we dive deep into calcium channel blockers, a common drug class that can bring unexpected and severe side effects. While effective, these drugs act differently in older adults, triggering reactions ranging from mild discomfort to life-threatening medical emergencies. Understanding these specific risks is not just about comfort. It is crucial for preventing misdiagnosis and maintaining independence in aging. Why does a standard dose affecting a 30-year-old barely touch them while potentially overwhelming a 70-year-old's delicate system? As we age, our liver and kidneys work slower, meaning drugs stay in our system much longer than intended. This accumulation creates a higher potency, turning a therapeutic dose into an overdose that the body struggles to process. The first sign is often ignored or attributed to old age, but it is actually a direct result of medication. Let us examine the most common side effect, affecting up to 30% of users: severe swelling in the legs. The medication relaxes blood vessels to lower pressure, but gravity forces fluid to leak from capillaries into the surrounding tissues. This fluid retention makes legs feel incredibly heavy, transforming a simple walk across the room into an exhausting physical challenge. Shoes no longer fit properly, and the skin becomes tight and shiny, causing significant discomfort and distress throughout the day. The swelling compresses nerves, reducing sensation and making it harder for seniors to feel where their feet are stepping. This loss of proprioception drastically increases the risk of tripping, turning minor obstacles into major hazards for the elderly. If left untreated, this condition can lead to skin ulcers and infections, complicating the health of an already frail patient. Statistics show that patients over 70 are 3 times more likely to experience this specific side effect than younger adults. While elevating legs helps, it does not solve the root cause if the medication dosage remains unadjusted for their age. Beyond swelling, there is a profound sense of fatigue that can strip away the motivation for daily living activities. Calcium is vital for muscle contraction, and blocking these channels can inadvertently weaken the skeletal muscles needed for movement. Routine tasks like cooking dinner or even holding a cup of tea become surprisingly difficult due to this drug-induced weakness. This is not just normal aging. It is a chemical interference, preventing muscles from receiving the signals they need to work. Furthermore, if blood pressure drops too low, the entire body suffers from a lack of oxygen and vital nutrient delivery. This leads us to the next critical danger: dizziness and the terrifying risk of sudden falls in the home. Orthostatic hypotension occurs when you stand up and gravity pulls blood down, but the medication prevents vessels from constricting. The brain is momentarily starved of oxygen, causing the room to spin and vision to blur into a dark tunnel. For an elderly person, a fall is catastrophic, often resulting in hip fractures that permanently reduce mobility and independence. Traumatic brain injuries are also a major risk, as seniors on blood thinners may bleed internally after hitting their head. Recovery from such falls is slow and painful, often marking the beginning of a significant decline in overall health. Family members must be vigilant, watching for signs of unsteadiness whenever their loved one stands up from a chair. Now, we uncover a silent side effect that is frequently tragic: the decline of cognitive function and memory. When blood pressure is suppressed too much, the brain does not receive enough flow to maintain sharp, clear thinking. This creates a state of brain fog, where thoughts become sluggish, concentration is impossible, and names are easily forgotten. Tragically, these symptoms mimic dementia, leading doctors to misdiagnose Alzheimer's disease instead of checking the medication dosage. Families despair, thinking they are losing their loved one to a degenerative disease, when the culprit might be reversible. Restoring proper blood pressure often clears this mental fog, proving that the brain was simply starved, not damaged. It is imperative to distinguish between true cognitive decline and the temporary confusion caused by aggressive blood pressure management. Another distressing symptom is palpitations, where the heart feels like it is fluttering or pounding out of the chest. When blood vessels widen rapidly, the body senses a drop in pressure and reflexively speeds up the heart rate. This reflex tachycardia can be terrifying, causing anxiety and making the patient feel like a heart attack is imminent. Facial flushing is also common, as the capillaries near the skin surface dilate, creating an uncomfortable sensation of heat. Sudden vasodilation in the brain can trigger severe, throbbing headaches that standard painkillers often fail to alleviate effectively. A strange and less-known side effect is gum overgrowth, where gum tissue swells and grows over the teeth. This can lead to dental infections, pain while eating, and difficulty maintaining oral hygiene for elderly patients. Nighttime leg cramps are frequent, disrupting sleep and leaving seniors exhausted and sore the following morning. We must issue a critical warning about a common food that acts like a poison when mixed with these drugs. Grapefruit contains compounds that disable the enzymes responsible for breaking down the medication in your digestive system. This causes the drug to flood your bloodstream at dangerous levels, significantly amplifying every side effect we have discussed. A single glass of grapefruit juice can boost drug levels to toxic heights, risking kidney failure or severe hypotension. The solution is not to stop medication abruptly, but to work with doctors to find the lowest effective dose. With proper monitoring and adjustment, side effects can be managed, allowing seniors to live active, happy, and safe lives. Regular monitoring at home gives you the data needed to protect yourself and communicate effectively with your healthcare provider. Lifestyle changes like low-salt diets can also reduce the need for high doses, minimizing the risk of adverse reactions. Awareness is your best defense against swelling, dizziness, confusion, and the silent dangers lurking in your medicine cabinet. If you notice any of these symptoms, do not suffer in silence. Speak to your doctor immediately about alternatives. Health is a delicate balance, and understanding your body's unique needs is the key to preserving it for years. You have the power to take control. Ask the right questions and ensure your golden years are truly golden. Thank you for watching Wellness Unfolds. Please subscribe for more vital health insights, stay safe, and prioritize your well-being always. Now, let us journey deeper into the microscopic world to understand exactly how these calcium channels function within your cells. Imagine tiny gates on the surface of your heart and blood vessel cells, designed specifically to let calcium enter. When calcium enters, it triggers a strong squeeze, constricting blood vessels and raising the pressure within your circulatory system. The medication acts like a precise cork, blocking these gates and preventing calcium from triggering that strong muscular contraction. Without calcium's signal, the vessel walls relax and widen, giving blood more room to flow and lowering overall pressure. However, these drugs primarily dilate arteries, not veins, creating a pressure imbalance that forces fluid out into tissues. This mismatch is the precise biological reason why your ankles swell. The fluid has nowhere to go but out. In older adults, the lymphatic system is less efficient at draining this excess fluid, exacerbating the swelling significantly. Combined with thinner skin and weaker muscle pumps in the legs, the elderly body becomes a perfect trap for fluid. This relaxation effect is not limited to blood vessels. It also affects the smooth muscles of your digestive tract. Chronic constipation is a frequent complaint, as the gut muscles lack the calcium power to move waste effectively. Hydration and fiber become critically important, yet many seniors limit fluids to avoid bathroom trips, worsening the problem. The valve keeping stomach acid down is also a muscle that can be weakened, leading to painful acid reflux. Heartburn can disrupt sleep and appetite, creating a cascade of health issues from a single blood pressure medication. Let us not overlook the psychological toll. Constant fatigue and brain fog can mimic or trigger symptoms of depression. Social isolation increases when seniors feel too weak to go out or are embarrassed by their swollen legs. This inactivity creates a vicious cycle, causing further physical decline that is often wrongly attributed to natural aging. Compression stockings can be a game changer, mechanically aiding the veins in pushing fluid back up towards the heart. Sleeping with legs elevated slightly above the heart allows gravity to work for you, reducing morning swelling significantly. Sometimes, simply switching to a different class of medication can eliminate these side effects while still controlling pressure. Adding a low-dose diuretic can help remove the excess fluid, balancing out the side effects of the calcium blocker. However, never stop taking your medication suddenly, as this can cause a dangerous rebound spike in blood pressure. Rebound hypertension increases the risk of stroke immediately, making the withdrawal process just as critical as the treatment. Caregivers play a vital role in observing changes, as the patient may not notice the gradual onset of symptoms. Keeping a daily journal of blood pressure readings and physical symptoms provides your doctor with invaluable data for treatment. Routine blood work is essential to monitor kidney and liver function, ensuring the body is handling the drug safely. Adopting the DASH diet can naturally lower blood pressure, potentially allowing for a reduction in medication dosage over time. Reducing sodium intake is particularly effective for the elderly, directly combating the fluid retention caused by these medications. Water aerobics is an excellent exercise choice, as the water pressure helps compress legs and reduce swelling naturally. Managing stress is also key, as stress hormones can tighten blood vessels, working against the medication's intended effect. We have traced the path from the molecule to the symptom, revealing the complex interaction between drug and aging body. Knowledge transforms fear into empowerment, allowing you to navigate your health journey with confidence and clarity. Always provide your doctor with a complete list of every supplement and over-the-counter pill you take to avoid interactions. Even herbal supplements can alter how your liver processes blood pressure medication, leading to unexpected and dangerous results. Alcohol is another vasodilator. Combining it with these drugs can cause blood pressure to bottom out dangerously fast. Taking your medication at the same time every day maintains a steady level in your blood, preventing highs and lows. Some doctors recommend taking blood pressure medication at night to prevent morning spikes, but always follow specific advice. While rare, true allergic reactions like hives or difficulty breathing demand an immediate call to emergency services. Newer generations of these drugs are designed to be gentler, with fewer side effects than the older original formulas. Your genetics also play a role. Some people are slow metabolizers who are naturally more sensitive to standard doses. Pharmacogenomic testing is an emerging field that can predict exactly which blood pressure drug works best for your DNA. Cost should not be a barrier. Generic versions are equally effective and often much more affordable for seniors on fixed incomes. Consistency is key. Skipping doses can make blood pressure volatile, increasing the risk of stroke more than high pressure itself. Joining a support group can provide emotional comfort and practical tips from others walking the same path as you. Technology can help. Simple smartphone apps can remind you to take your pills and track your blood pressure trends. Do not underestimate your pharmacist. They are experts in drug interactions and often catch errors that doctors might miss. Be aware that weather affects blood pressure. Cold constricts vessels while heat dilates them, potentially amplifying drug effects. In hot weather, staying hydrated is crucial to prevent your blood pressure from dropping too low due to the heat. Hot baths or saunas cause massive vasodilation. Use extreme caution, as standing up afterwards can cause immediate fainting. Watch for the subtle signs, like a sock leaving a deeper mark than usual, to catch swelling early. Pay attention to momentary dizziness when standing. It is a warning signal from your body that should not be ignored. Quality sleep is essential for blood pressure regulation. Sleep apnea can cause dangerous spikes that medication struggles to control. If you snore heavily, get checked for sleep apnea, as treating it can sometimes cure high blood pressure completely. Your kidneys and blood pressure are locked in a tight relationship. Protecting one helps to preserve the function of the other. Regular kidney function tests are non-negotiable for anyone taking these medications long-term to prevent silent organ damage. Blood pressure medications can affect sexual function. Discussing this openly with your doctor can lead to solutions. You do not have to accept poor quality of life as the price for controlling your blood pressure. Modern medicine offers a vast arsenal of options. Finding the right fit for your unique body is entirely possible. It may take some trial and error, but finding the perfect balance of efficacy and comfort is the ultimate goal. Your body speaks to you constantly through symptoms. Learning to listen and interpret these signals is your responsibility. Prepare for doctor visits by writing down your questions. This ensures you get the answers and care you deserve. Never be afraid to ask your doctor to explain things simply. It is your body, and you must understand it. If your concerns are dismissed, seeking a second opinion is a wise and valid step towards better health. Patience is required. Blood pressure adjustments happen slowly, and finding the right stability is a marathon, not a sprint. Share this information with your aging parents or friends. It could spark a conversation that saves them from suffering. Our community at Wellness Unfolds is here to support you, providing evidence-based knowledge for a healthier, longer life. Imagine walking freely without heavy legs, thinking clearly without fog, and living without the fear of sudden falls. Imagine preserving your sharp mind and memories, distinguishing true aging from the reversible fog of medication side effects. This future is possible when you understand the tools you are using and respect the unique physiology of aging. Start today by checking your ankles, monitoring your pressure, and having that crucial conversation with your healthcare provider. Medication should be a tool that serves you, not a master that dictates your limitations and daily suffering. Remember that you are a unique individual. Standard guidelines are just a starting point, not the final rule. Geriatric specialists are trained to navigate these complexities. Consider seeing one if your current regimen feels wrong. Medicine is always a balance of risk and benefit. Ensure the scales are tipped in favor of your well-being. We owe much to science, but we must apply it with wisdom, especially for the vulnerable bodies of the elderly. Keep the big three in mind: leg swelling, dizziness, and fatigue. These are your red flags for action. Never forget the grapefruit rule. It is a simple dietary change that can prevent a medical catastrophe. Be proactive, be observant, and advocate for the quality of life that you have earned and deserve. Your health journey does not end with a prescription. It is a continuous process of listening, adjusting, and living. Wellness Unfolds will continue to bring you the deep dives and explanations you need to navigate this journey. If this video opened your eyes, please subscribe and click the bell so you never miss a life-saving update. Share your experiences in the comments below. Your story might help someone else recognize their own symptoms today. Remember, this video is for educational purposes only and does not replace professional medical advice from your doctor. May your days be filled with health, clarity, and the peace of mind that comes from true understanding. Protect your health, not just for yourself, but for the generations that look up to you for guidance. Aging should be a time of joy and reflection, not a struggle with unnecessary and manageable medication side effects. Thank you for trusting us with your time. We are honored to be a part of your wellness journey. Check out our other videos for more insights into heart health, nutrition, and the science of aging gracefully. Stay curious, stay informed, and most importantly, stay healthy. Until next time, take good care of yourself. Visit our website for detailed articles and resources that complement the topics we have covered in this video. Thank you for watching Wellness Unfolds. Please subscribe for more vital health insights. Stay safe and prioritize your well-being always.